Good afternoon, everyone. Thank you for joining us. Welcome to the Great Physician Ministries. Today we will focus on a small talk talking about hypertension. The feeling is we've been focusing on COVID, and rightfully so, we have to focus on COVID. And somehow we forget our chronic conditions, which have always been here with us, which will continue to be here with us after COVID-19. So today we'll talk about hypertension, and the main focus really, it's not some high-profile medical presentation or a general review, but we'll just talk to people and understand really, in fact, make people understand what hypertension is, how it presents, what the complications of hypertension are, and what one can do at home to sort of, prevent having high blood pressures. And most importantly, we will emphasize on compliance because we know hypertension is one of the conditions that has to be managed appropriately. People have to go on to take their medication every day or every month at least. And really, you have to be adherent to your medication. The bulk of the complications we see because of poor compliance. So we'll be talking about compliance. But with me here, I have a friend and a colleague, Dr. Darlene Boakye, will be talking to us about what hypertension is, how it presents, how one can navigate around hypertension. And for the general population, hypertension really means high blood pressure. So what we'll talk about today is high blood pressure. So without wasting much time, I will now invite Dr. Boakye to join me in talking about hypertension. Welcome, Dr. Boakye.
Hi, thank you. It's a great honor and privilege to be here on the Great Physician Ministries.
Tell us, Doc, what is hypertension? Just for the general population to understand, what is hypertension and how would you define what hypertension?
Sure. So essentially, hypertension is what we describe as high blood pressure. As doctors, we define it as a blood pressure of 140/90. So I know a lot of people go to the clinic or go to your GP for certain reasons, and blood pressure machines or measurements are done. And no one really tells you what the normal blood pressure is or if your blood pressure is elevated or low. But the main readings you should look out for is 140/90. So if it's anywhere above that, that is essentially classified as hypertension.
Yes, Doc. So we obviously we know the definition of hypertension as you have told us, and people will argue that Doc, I don't feel anything. I'm okay. How do I then get to know that it's time for me to probably be checked for hypertension, or how will I know that probably I could be having this hypertension? In other words, what are some of the known risk factors for hypertension that one obviously needs to know about?
Yeah, that's a good question, Luyanda. So essentially, hypertension usually affects the elderly. So anyone above the age of 45, I think you should be quite cognizant that you potentially could have hypertension. Younger people are very much able to get hypertension, especially if you're overweight or you have a family history. So one of the risk factors is family histories. So if your mom or dad had hypertension, it's something definitely to look out for. So it's quite ideal to do blood pressure measurements at least once a month if you have risk factors for hypertension. And I mean, hypertension is classified, famously as the silent killer. So everyone could walk around with very high blood pressure readings and not feel in any type of way different. Sometimes you can get a headache, or sometimes you might get blurry vision, or sometimes you might put on a lot of water on your body, which we call fluid overload. And those are, the common complications down the line of hypertension. So one thing you should just look out for is a headache. That's one of the main things. But as I said, you could walk around with very raised blood pressures and be completely fine. So it's quite important to do blood pressure readings at least once a month if you have risk factors or if you're at high risk. If you have things like diabetes or heart problems, I think that's probably ideal. Blood pressures are taken quite often.
Thanks, Doc. So essentially, hypertension, as we know, it's known to be a silent killer. So the bulk of the population, people are walking around and really they don't have symptoms, as Darlene said. But it's important for one to just go to their GP now and then, to the day hospital, to the clinic, just to check their hypertension, because hypertension is one of the conditions we often see when it's presents, and usually it presents with very big and sometimes fatal presentations. What are some of the presentations, Dr. Boakye, that we see these patients coming in with, hypertension complications?
So, the main complications we would look out for firstly would be heart attacks, okay? And usually you would experience, crushing chest pain, which they say goes down the arm. Sometimes you get a feeling of numbness, and then you start to sweat. And the chest pain just doesn't get better even with pain medication. That might be indicative of actually having a heart attack. So I would suggest getting to the hospital immediately. But obviously these are huge complications that we don't want to happen. So what we try and do is prevent these complications from happening by actually starting you on hypertension medication quite urgently. So as I said, the first thing would be a heart attack to look out for. Secondly would be a stroke. And we know strokes are very common nowadays. You might just wake up and one side of your body is weak, or you're unable to talk, or you're unable to eat. And that's also, one of the major complications of hypertension. And thirdly, we also have problems with the kidneys. So you can get chronic kidney failure, and sometimes it usually presents with no symptoms at all, actually, or sometimes it can present with, as I said, just water just all over the body, and you might just feel quite swollen. So those are the three major complications that I would suggest to look out for. Yeah.
Thanks, Dr. Boakye. Thanks a lot. So now we know, hypertension can present, with a stroke. We know you can either bleed or you can have a narrowing blood vessel on your brain. You can have heart attacks. You can have, like Darlene said, kidney problems. I know it's often, a condition whereby people, even when they are on treatment, they are reluctant to take their medication, because one will say, "No, doctor, I'm okay. I don't feel sick. I feel fine. I don't have anything." But I think the crux of this presentation really is just to make people aware that hypertension is a silent killer. You don't need to have, number one, a stroke for you to know that you are hypertensive. Secondly, you don't need to have myocardial infarction or heart attack for you to know you are hypertensive. And thirdly, obviously, you don't want to have a major bleed that can be fatal. So what we are saying today is that, number one, hypertension, you have to be adherent to your medication. And we will talk briefly now about things one can do that are non, medication related, that one can do in terms of managing hypertension. In the hospital, we speak of the non-pharmacological, modalities one can use. In other words, in as much as we can use tablets, we prescribe medication, but there are some things one can do to try to either, one, reduce hypertension, or two, to even prevent, one getting hypertension. Darlene, what are some of the things one can do at home, simple things people can do as a means of trying to avoid hypertension?
Just to go back to echo your sentiments, essentially, I am fortunate to be doing research on hypertension and hypertensive heart disease, which is essentially one of the complications of hypertension. And in my research, I've actually found that at least 83% of the population in sub-Saharan Africa have uncontrolled hypertension, and at least 70% are not on medication for hypertension. And this is obviously a big problem in sub-Saharan Africa based on the resources that we do have. So my advice at this point is, as soon as your blood pressure is elevated, go to your local doctor, go to a clinic, and start treatment urgently. This is very important. And once you are on treatment, modalities or things you can do to bring your blood pressure down significantly would be exercising. I think exercising is undervalued and underappreciated, but it's very important. Exercising for at least 30 minutes once a day, potentially for 5 days. is manageable. Secondly, having a low salt diet. I think that's one of the things, people don't really look out for, but salt is one of the major risk factors in actually pathophysiology of hypertension. So potentially the best is a no salt diet, but obviously we don't. That is very difficult.
Absolutely,
so,
yeah.
A low salt diet is ideal. Obviously, yeah. So I think the major two things would be exercise and your diet, and of course, education. Educate yourself about hypertension. Educate yourself about when you need to seek help from a doctor or a clinic. Educate yourself on how often you should take your medication and when you should take your medication, when you need to go to the clinic. This is very important. We obviously want to prevent complications from happening. We see complications every day, and it's not a nice feeling. Seeing someone with a stroke who had an excellent baseline, who was walking and talking, the day before.
Yeah.
And then you see them the next day and they literally have one side that's weak and they're not able to
Absolutely,
talk.
yeah.
So we just want to prevent all of these complications. We want to educate South Africa and the rest of the world to prevent these complications from happening. I obviously have a passion for this because I'm researching hypertension. And I think the best thing to do is if you have risk factors, go to the clinic, go to your doctor, do your blood pressure readings. And if you see it's over 140/90, inquire. Your doctor, is this elevated? And what can I do? What can I do to bring it down? I think that's the ideal thing. Thank you.
Thanks, Darlene. Absolutely amazing stuff here. So, Darlene obviously works in a tertiary institution. She sees patients coming every day with hypertension. And like she said, she has, researched this topic and is continually working on research, under this topic. So I think the more one has to appreciate at home is that we have seen, an increase in the so-called non-communicable diseases, whereby, because of urbanization and because of lifestyle choices, and the so-called, middle class syndrome, we see a lot of upper middle class people. Suddenly, people are going through drive-thrus. I'll not mention any outlets. People would cook previously, but now because they are affording, they are going to outlets whereby they'll just sit in the car and ask for some big meal with, some, big calories. And then after that, you go home, you open your computer. There's no, use of your energy that you've just accrued. So essentially, what we are saying is that there has to be a balance between calorie intake and output, meaning you have to eat in moderation if you can. And obviously, you have to ban the excess calories in the form of walking, running, or anything, or even cycling. Some people may argue and say, no, running is for young people. Even walking, you will be surprised how much you can get, in terms of benefits of walking, even if it's just 5 kilometers a day. So, to echo the sentiments of Darlene, we have to prevent hypertension. Of course, there is an element of genetics that play a role in hypertension. We often talk about modifiable and non-modifiable risk factors. And what I always tell my patients is, number one, I cannot change the fact that one is 65. Number two, I cannot change the fact that I'm Mbanga, that's me. I'm Luyanda Mbanga, that's my name. And Darlene is Darlene Boakye. We can't change that. Yeah. But we can obviously change our weight, body mass index. We can obviously change our, diet, high salt intake. We can often, just try to reduce and even consult a dietitian to help you with your meals, planning your meals. And thirdly, for people who are smoking, I'm hoping we don't practice that. But for people who are smoking, smoking has been shown to be directly related to the incidence and prevalence of hypertension. So also, smoking is something we should really try to cut down on. So we are doing this talk as just a way of motivating people. And it's the first of many. We will hear topics from people, what they suggest we should talk about. And really, this is not meant to intimidate anyone, but it's meant to give information and to to change practice. We will draw to the close of the session, but I want Dr. Darlene Boakye just to give us her closing remarks in terms of the hypertension, as a whole, and to emphasize really on what we can do at home as a way of trying to avoid and even to prevent or to manage hypertension.
Yeah, so I think information is key at this point. We've heard all of this information, and we at this point have no excuse. We know how to look out for hypertension. We know how to look out for the presentation of hypertension, and we know how to look out for the complications of hypertension. The major thing, even if you don't have hypertension, living quite a healthy lifestyle is ideal. Exercising, running, cycling, not even just walking around your yard. 30 minutes, just a nice walk. I mean, I feel like that should be doable. And of course, we want to prevent any complications from happening. So, as you've heard the talk, I hope that you enjoyed it. I hope that you've acquired some new information. And of course, if you have any questions, myself and Luyanda are always willing to answer any question at any time. Thank you so much for having me, and hopefully I will be back at any point soon.
Thank you, Darlene. Obviously, you'll be back. So, to the viewers at home, this was just an initiative of teaching people about simple conditions, things that are often missed. What we saw after the second wave is that we actually had a sort of a pandemic on its own of people who were sitting at home for the whole year, not taking their medication, and suddenly there was a rise of people coming in with complications of hypertension, a rise of people coming in with complications of low CD4 counts, cryptococcal meningitis, to mention a few, people coming in with seizures that are out of control because people were obviously scared to go to the health facilities. So we just thought we should emphasize that chronic conditions are obviously going to be here even after the pandemic, and the pandemic must not make us forget the things we know and forget that there are still chronic conditions we have to treat. In fact, if you look at the prevalence of TB, in South Africa or sub-Saharan Africa, it's still higher than COVID.
Yeah.
So meaning we cannot neglect other chronic conditions. So we hope you get the information, use it, apply it, and you will definitely see changes. One may argue and say, doctor, I've been eating this spinach and this cabbage. Obviously, some effects will not be seen or will not be appreciated immediately. But let's just keep on keeping on and keep on doing the right thing. Darlene, your last words to our viewers at home?
I think everyone has learned a little bit about hypertension. As Luyanda said, chronic diseases are always there. They will always remain there. We've got about 1 billion people in the world at this point walking around with hypertension, some unknowingly. So since we know what's going on, please at least get your blood pressure checked once. And all the best, and have a lovely weekend further.
Thank you. Thank you so much for joining us.
Thank you.
Catch us again sometime this coming week. We will give you flyers before, and you can suggest topics you want to hear, topics you want us to talk about. And in fact, you can interact with me, and we want to do this as a way of educating each other. May you stay blessed and